If you've ever had a pet with a serious health condition or even known someone who actually has, then you know how heartbreaking it can be.
And that's why our next guest is dedicated to offering the latest and most effective treatment options available. So we welcome the owner of Sevo Med, Dr. Tracy Ledoux. Welcome.
Thank you.
Great to have you.
So happy to have you.
Yeah.
And this is a topic that not a lot of people are prepared for. So we're obviously very, very grateful that you're here. So tell us, what is Sevo Med and how long have you been with the company?
Sevo Med is Southeast Veterinary Oncology and Internal Medicine. We founded the company in 2004. We've been around for a little while here in Jacksonville, serving pet owners who have pets with special needs, internal medicine issues like diabetes that your general practitioner feels uncomfortable managing and controlling. Cancer is what I do for a living. I'm a veterinary oncologist. The internist can treat things like liver failure, organ failure, things that your regular veterinarian feels uncomfortable managing and wants to refer on for higher diagnostics or treatment capabilities that we have at the specialty level.
Yeah, we need somebody who specializes for sure whenever it gets to that oncology level. I mean, I went through it personally with my animal and she did as well, so we always need you. But you're here today specifically for one service, and it's SRS. It's stereotactic radiosurgery.
Yes.
Tell us about that.
You'll also hear the term stereotactic radiation therapy, or SRT. And this is a more precise delivery of radiation therapy, which is really exciting. I'm a breast cancer survivor, and I went through radiation myself. Thank you. 5 years this January. But when you go through radiation like that with the conventionally fractionated schemes where we give a little dose every day for 6 weeks, your normal tissues will start to break down and you can have side effects from that. And I'm sure everybody's heard about the radiation side effects that can occur. That can be sometimes debilitating. If you had a head and neck tumor, sometimes people need to get feeding tubes to get them through the radiation experience, always with the end game of trying to get you a cure. In the veterinary world, we certainly want to cure our pets. We love them, they're part of the family. But we don't want to cause them the side effects that people have to go through. So quality of life has to be our primary concern over quantity of life. So I was really excited to meet with the group Pet Cure Oncology because they are partnering with me so that I can provide this new, very specialized, very technical radiation therapy that helps me to center the radiation on the cancer cells only, but stay off the normal tissues.
How amazing is that?
Is that the biggest difference between kind of the traditional treatment and the SRS or the SRT?
That's one of the main things, but for, let's say, I went through the breast cancer treatment and I went up to my oncologist every day for 6 weeks, and I laid in my frame, got my radiation treatment to my armpit and chest wall. And I could lay there. I will do what the technical staff tells me to do, the radiation therapist, but tell Muffy or Buffy to do that, to lay on the table and get their treatment.
Not happening.
No. So they need to be anesthetized. And it's a short treatment, but imagine 4 weeks of anesthesia every day. And they do well with it, but this particular treatment now, because we can give a higher dose and so tailored to the tumor alone, we only have to do it in 1 to 3 fractions. So they're done in 1 to 3 treatments compared to 20 treatments.
That's a lot less scary for them too, because like even though we know that our pets have some kind of sixth sense when it comes to they know what's going on, they feel it.
Well, think about the pet owner too. How much easier is that for them? Who wants to bring your cat in every day for 4 weeks? By the last week, the cats are like, I am not getting in that carrier, forget it.
That learned response. Yeah. Well, what about the animals that have the untreatable diagnoses, though?
That's an excellent, thank you. That's an excellent question because we can treat things that we couldn't treat before. So a lung tumor, for example, if it's inoperable, you can always go to surgery for a small lung tumor, and that's standard of care. But if it's a big inoperable tumor, or you have a patient that probably is
that what we're looking at here?
That's actually a brain tumor. So same thing. That's a brain tumor that is likely not very operable based on its location. And the picture on the left is the contrast enhancing mass. That's what that circle is with the arrow pointing at it. And the picture on the right is after 3 doses of radiation therapy, that tumor is gone.
After only 3 doses.
And did not have to have surgery. So that is a game changer for the veterinary profession and is standard of care in a lot of cancers in the human profession. So by partnering with Pet Cure, our facility, Sevo Med, is able to bring this technology to your patients, to your little kids, your four-legged kids.
I love that.
After only 3 treatments. But then what are some of the other benefits, obviously, besides reducing, you know, untreatable tumors?
Well, the less anesthesias, the less treatments, and the biggest thing is coming down off of the side effects that patients that get conventional radiation are experiencing. So there's lots of benefits to it. It's wonderful.
And so coming off of that, how do I guess animals react to coming off the anesthesia, off of the drugs?
Oh, very well. We use a lot of the drugs that we get, you get as a person. I've had more than my share, but you know, your routine propofol induction, which is the white stuff, and they give it to you. You count backwards from 10, and you're like out of it by 8, and you wake up and go, wait, you ruined my nap. We use that agent. There's other agents that we use, so all of those patients should be able to walk out of the building after their 15 to 20-minute procedure. We want them home with mom and dad so that they're comfortable and happy and not experiencing side effects.
Well, the best part is though your locations, because I mean I drive by you guys all the time, so tell everybody where your locations are.
Well, we have one facility that is in Orange Park off of Corporate Way. And we have a second facility that is on Beach Boulevard and San Pablo, excuse me, yes, out there by Mayo. And a lot of people are like, oh, it's the beach office, but it's not quite. It's in Jacksonville proper. So it's nice to have those. The radiation facility is in the Orange Park office, but the oncologists that are at the Jacksonville office are able to consult and prepare the clients, and then they can get over to the Orange Park office if radiation is deemed necessary.
And do you have a best story that you can think of that just hits your heart of like some animal that you've saved recently?
Well, there are, gosh, there's so many of them. And
try not to make us cry. We still have to get through the rest of the show.
I know. Well, there are absolutely so many patients that I don't know that I could name any of them in particular, but one that's we're fond of that we've talked about before is the tiger Topaz that was treated from Caddyshack Ranch, and she had a lymphoma mass that was so enormous on her foot that we couldn't do surgery. And so we used radiation to shrink the tumor, and it got small enough that we were able to then go to surgery with the board certified surgeons that are in town, have it resected, and she got put back out on exhibit for over 18 months before she passed away.
Oh my goodness.
So if it can help a tiger, it can help your little pup.
Yeah.
That's for
I
sure.
wish I had had you guys when mine was going through it. I would have loved to have had you guys.
But well, thankfully, you know, all of our viewers now know that this is a very, very useful option.
Thank you. Yeah, cancer is the #1 cause of death in animals over 10 years old, so a public service announcement. Have your animals, your pets evaluated by your referring vet regularly. I think yearly is very, very wise at least, and any lumps or bumps need to be aspirated and evaluated to make sure that we catch things early when they can be cured.
Exactly. Well, thank you so much. Exactly. Thank you so much for coming.
Thanks,
we really appreciate it.
Thank you.
And for more information on SRS technology, you can visit sevomed.com and look under the resources tab. Sevo Med has locations in Orange Park off Wells Road and at the corner of Beach Boulevard and San Pablo Road.
And coming up next, taking a page from a very old book when it comes to relationships, Dr. Richard Marks is with us next.
Next, Ellen.